We're also being joined by Heidi Marston, the Interim Executive Director of LASA, the Los Angeles Homeless Services Authority, and she will share details of our ongoing collaborative efforts to protect people experiencing homelessness. We recognize the profound toll the crisis has taken on our LA County residents. To that end, all of our county departments, partner agencies, and service providers are working around the clock to help those struggling and those most in need. I want to thank our essential employees for their noble service. Today, in fact, in partnership with the Los Angeles Community College District and East Los Angeles Community College, we opened a testing site at ELAC. The Los Angeles County is offering a drive-through COVID-19 testing site for the community, 7 days a week from 9 a.m. to 5 p.m. They can test up to 250 persons per day. The testing site is operated by our hardworking Roybal Health Center staff, LA County Fire Department and lifeguards, and volunteers from across the 1st District. The drive-up sites provide individuals in East Los Angeles, Monterey Park, and the surrounding communities with a quick and safe way to get tested in order to slow the spread of the virus. Like with all county testing sites, please visit coronavirus.lacity.org/testing or call 211 to see if you're eligible for COVID-19 testing. Next, I'd like to take a moment to thank Governor Gavin Newsom for his leadership during these trying times. On Friday, Governor Newsom announced the Project Room Key initiative to provide shelter to many Californians experiencing homelessness by leasing hotel and motel rooms. At this time, Los Angeles County has a goal to secure 15,000 rooms for vulnerable individuals experiencing homelessness in partnership with the state, our cities, LASA, and the hotel-motel industry. Homelessness and health experts have shared that the unsheltered homeless population is at a greater risk of contracting the virus because many are older and have serious underlying health conditions. People experiencing homelessness have a higher burden of cardiopulmonary and immunocompromising conditions like COPD, chronic obstructive pulmonary disease, heart failure, diabetes, and they also experience accelerating aging and frailty. Additionally, people experiencing homelessness have limited access to hygiene supplies, living conditions that limit infection control practices, and often live in communal settings such as shelters, on the street, or crowded encampments. These hotels and motels will help us flatten the curve by providing a safe space for individuals to isolate, especially for people who are over the age of 55 and who have underlying medical conditions. Project Room Key is a massive undertaking that requires many people and agencies working together to lease these motels and hotels. This is a high priority for the county, and we thank our service providers for stepping up to the task and county disaster service workers for helping to staff these sites. Expanding shelter countywide is the goal of the county and has already been working toward before the COVID-19 crisis, but it's now more urgent than ever. As COVID-19 continues to spread throughout the country, we have a moral and ethical responsibility to do our part. Project Room Key will ensure individuals receive wraparound services such as meals, custodial services, mental health, and healthcare services during the public health crisis. If you have a hotel or motel that could be leased for Project Room Key, please reach out and contact the County of Los Angeles. In conclusion, the county will continue to work with our cities, the state, community, and private partners to assess facilities and properties throughout the county that could serve as quarantine, isolation, and testing sites. This is no small feat, but we must work together, practice compassion, and utilize every resource that we have available to stop the spread of this virus. And now, I have the great honor and pleasure to introduce Dr. Barbara Ferrer, our Director of Public Health.
Good afternoon, everyone, and thank you so much, Supervisor Solis, for your leadership across the county and for really reminding us every day about what what's our role as people in government? You know, it's here to be of service, and every day you live your life as an example to all of us for what that means. I want to update you today on our current status here in LA County. I'm sad to report an additional 29 deaths have occurred. 17 of the people who died were over the age of 65, and 16 of the people who are over the age of 65 had underlying health conditions. 7 people passed away who were between the ages of 41 and 65, and 5 people between the ages of 41 and 65 had underlying health conditions. 1 person was younger, between the age of 18 and 40, and they also had underlying health conditions. We don't currently have information for the 4 additional deaths, 3 of which occurred for residents in Long Beach and 1 which occurred among a resident from Pasadena. This brings the total number of deaths in LA County to 198, and unfortunately, our mortality rate has risen again to 2.6%. My thoughts and prayers are with everyone who's lost a loved one to COVID-19, and I wish you peace as you heal. Today, we're also reporting 620 new cases. Over the last 48 hours, our total is 1,170 cases, and that brings us to 7,530 total cases here in LA County. These cases include 256 cases reported by our partners in the city of Long Beach and 80 cases reported by the city of Pasadena. We're also reporting 12 confirmed cases amongst people experiencing homelessness. This is an additional 2 people from the 10 people I reported yesterday. 77% of all of our positive cases continue to occur among people between the ages of 18 and 65. And again, as a reminder, this infection is spread by people of all ages across the entire county. There's about slightly over 1,700 people who have been COVID-19 positive, who at some point during their illness were hospitalized, and that's 23% of all of our positive cases. Currently, there's 1,033 people who are hospitalized, and 44% of the people who are hospitalized today are over the age of 65. 17%, however, are under the age of 45, a stark reminder that everyone can not only become positive for COVID-19, but actually can become ill enough to require a hospitalization. You can see our complete updated report on LA County cases on the Department of Health's website at publichealth.lacounty.gov. We're also currently investigating 131 institutional settings. This number continues to grow with the number of positive cases that I announce every day and the increased number of deaths. These institutions where we're investigating have at least 1 confirmed case of COVID-19, and as a reminder, they include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in our institutional settings is 596, and this includes 314 cases amongst residents and 282 amongst staff. And I'm really sad to report that in our institutional settings, the number of deaths has also risen to 37 residents who were positive for COVID-19 who have died. Today, we're reporting 43 confirmed cases in the jail facilities. This is 3 inmates and 40 staff. There are 10 cases in the state prison system in LA County. That's 8 inmates and 2 staff, and there are 2 cases among our juvenile facilities, and those are both among staff. In the shelters that are serving people experiencing homelessness, we have 4 confirmed cases. 2 were among staff residents, and 2 were among staff members, and 2 were among residents at the shelters. As a reminder, we post a list of facilities with confirmed cases on our website once those facilities have had an opportunity to notify their staff, residents, and families. Our DPH teams do work with every single one of the institutional settings that has at least one confirmed case, and the management and the staff are working closely with us to try to protect the health and well-being both of employees and of residents. Many residents in these facilities are appropriately quarantined, and we ask all of you to understand that this means that there are absolutely no visitors allowed at all of these facilities. I wanted to talk a little bit about healthcare workers today. They're the front line of the pandemic, and we all owe them an enormous debt of gratitude. So thank you to everybody who's doing healthcare work in all of the institutions that provide medical services and clinical services to the residents here throughout the county. We have documented 324 healthcare workers that have tested positive for COVID-19. The three main settings that are reporting these cases include our hospitals, which report 58% of the cases, outpatient facilities, which report 16% of the cases, and emergency medical services, which is reporting 6% of the cases. Nurses are the group of healthcare workers most likely at this point to have tested positive for COVID-19, followed by physicians, EMS, paramedics, and EMTs. We're sad to report that 2 healthcare workers who were positive for COVID-19 passed away. I spoke about this earlier last week. And again, to the families and friends of these brave frontline workers, we're so deeply sorry for your loss. And for me, the words thank you don't really convey the gratitude I feel to all of the frontline healthcare workers. You're heroes, and we appreciate your commitment to continuing to take excellent care of all of us, while we know you're facing the impossible task of juggling caring for your families while showing up every single day on the front lines. As of yesterday, 36,500 people have been tested in LA County. 15% were positive. I want to clarify that when we report on the number of people who have been tested, there is a lag time. We are reporting on not only the number of people who have been tested, but we're actually reporting on the number of people for whom we have test results. So the last few days, particularly across the county and the city of LA, there's been a dramatic increase in testing sites and the availability of testing, and our numbers will not reflect this for a few days because we won't have those test results back yet. And testing capacity continues to improve every week here. Please note that all of the county testing sites and the city testing sites are limited to people who are symptomatic. But we're still not up to having the capacity to test 10,000 people a day. So I want everyone to be aware as we get to that capacity, the number of positive cases will continue to rise here in the county. And certain groups of people who are symptomatic, we ask that you please make sure you talk with your provider and get tested if you have COVID-19 symptoms. These, again, are people who have greater risk for serious illness and disease. That includes people who are 65 and older, people with serious underlying health conditions, and pregnant women. If you need help finding a test site, please go to the county's website. They're listed there, and it's very easy for you to sign up and be seen at one of the county and the city test facilities. Today, I also wanted to talk a little bit about our guidance for people with differing abilities or people with disabilities during the COVID-19 pandemic. I've talked a lot about the fact that people with chronic conditions, and this includes heart, lung, kidney disease, diabetes, as well as those with a decreased immune function, are at higher risk of becoming seriously ill if they were to become infected. But people of differing abilities also may have increased risk if they too fall into one of the categories of having an underlying health condition, especially those that affect lung function. And so for all of us, including people with differing abilities, the best way to keep from getting infected is to reduce the contact with people who may carry the virus and with places where infected people may be present. But I want to note that for people who require caregivers every day to be in their lives to support their ability to fully function, we have special instructions for you. And again, we ask that the first point is to limit your close contacts with everyone else as much as possible. This includes your family members. We recognize that you have a caregiver that often is in close contact with you, but it's very important for people with differing abilities that rely on a caregiver to make sure that they're trying to keep 6 feet away from everyone else, even other people in their household. Caregivers need to be particularly careful not to bring the virus into the house of a person with differing abilities. If they have any symptoms of illness, they should stay home, and an alternate caregiver should be sent to your home. Even if they don't show any signs of illness, caregivers should always wear disposable gloves and a face mask at any time when their job requires close contact with you. Need to have all surfaces wiped down frequently, particularly those surfaces that you're both touching. And it's a good idea to also make sure that you're wiping down any equipment regularly. Everyone in the household needs to wash their hands frequently, and everyone needs to avoid touching their faces. Folks who have differing abilities and have physical limitations in getting around should take this time to make sure that they've arranged to have their food, medication, and supplies delivered. Be sure you have everything you need to meet your ongoing health needs for at least the next 30 days. This includes having a personal emergency plan that writes down the information on how to reach all of your healthcare providers, any specialists and therapists, and any 24/7 links that are provided by your healthcare team. There should be contact information on the pharmacy you use and information on other services that you use, such as meal programs, care coordinators, and any telehealth services. If you're relying on home medical services, please make sure that that information is also included on the care plan and that there's a transportation plan in place that allows you to get safely to and from any appointments for out-of-home medical services. If you develop any symptoms, mild symptoms, you should be in touch with your regular healthcare provider as soon as possible. We do have detailed guidance on our website for people with differing abilities. That's publichealth.lacounty.gov. This guidance includes information about resources for food and transportation, as well as specific guidance on cleaning and disinfecting. I want to thank so many of you for settling into routines that allow you to stay home safely, maintain your physical distance from others, and now you've adopted wearing a cloth face covering when you must be out. I know this is temporary. I know it's going to change, and we will get back to many of our normal routines, but it will take significant time. And please understand that we have weeks to go before we're able to lift any of our health officer orders. And I know this is hard and that many people have made enormous sacrifices for us to be able to get through these days together. And I know also that many people are observing our faith holidays and traditions right now, and we must all do this while we stay home. This is not easy. Please know that what we're doing right now is saving lives, the lives of those people who are most vulnerable, the lives of those people you love, and your life. We're going to get through this together, LA County, and I'm grateful for all that you're doing. And now it's my pleasure to introduce Dr. Galley, the Director of the Department of Health Services.
Hi, I'm Dr. Christina Galley, the Director of the county's Department of Health Services. Thanks for joining us again today. My thanks to the Board of Supervisors, all of the county elected officials, all of our partners in homelessness services and on the healthcare front lines for all the work that you're doing every day and for bringing the resources to bear to be able to combat this pandemic. We are at a critical moment in the trajectory of COVID-19. the only way, the best way to slow the trajectory of this disease is by observing the safer at home and social distancing, physical distancing guidelines that have been put forward by the Department of Public Health. I know that they're hard. I know that people are under some stress and anxiety, and I know that this is a difficult time for many of you. But I want to thank you for your observance of these rules, for these health officer orders, and just encourage you to stay with it in the weeks to come. It is making a huge difference in our ability to be able to lessen the scope and the peak of those infections, and it's making a difference in terms of saving the lives of those you love and those around you. We'll be making some comments later this week, likely on Friday, to give a broader picture of what we anticipate in the days to come in terms of modeling the trajectory of this epidemic. So we look forward to having you join us on Friday for those enhanced comments. Today, I'll focus on DHS's role in serving people experiencing homelessness and also in those coming out of our correctional institutions, and I'll provide a brief recap of the bed count numbers. The Department of Health Services Housing for Health Unit works with a variety of partners, including LAHSA, who's with us here today, the Department of Mental Health, Department of Public Health, and others, on providing a range of supports to persons experiencing homelessness. The DHS staff provide expertise in establishing the quarantine and isolation sites that have been established throughout the county. They're training outreach teams and interim housing providers on PPE and medical protocols, and they're providing services to some of the more medically fragile and vulnerable persons experiencing homelessness at some of the specific sites. DHS has a specific role at one of the sites, which is Dockweiler, which today is in the process of moving from the site at Dockweiler State Park over into an alternative site at Bell Gardens to serve those individuals who are most medically fragile in terms of having complex underlying health conditions, or who might have substance use disorders or complex behavioral health conditions or mental illness. They provide those services on that site to a large set of individuals who have been identified as needing them, and we will continue to do that in the days to weeks to come. To date, there have been 77 clients served at that Dockweiler site, with more anticipated to be served in the weeks that will come. We also have services that are available on the MLK campus in South LA that are being provided through partnership with JWCH. And I want to extend my thanks to all of the partners across the county who have pitched in at the various quarantine and isolation sites to provide housing services, homelessness services, wraparound services, case management, medical and clinical services. It takes a team to pull all of this together, and I'm grateful for the contributions of so many people. In the correctional health environment as well, as you may know, there's been great efforts to be able to reduce the size of the jail population, which is currently down to about 15,500 over the course of the past several weeks. This is largely done by reducing the bookings of inmates into jail where possible, with an eye on preserving public safety, and then also on securing release of certain individuals who do not require a correctional environment. Department of Health Services has been working in partnership with the Superior Court System, with the Sheriff's Department, the Probation Department, and our justice partners broadly to be able to plan for housing and supportive services options for individuals who are medically fragile or who have serious mental illness and need placement in a housing environment upon release. I am pleased to report that in the past month, we've already connected 200 individuals with serious mental illness or who are extremely medically fragile with housing programs, and with plans to be able to house an additional 200 in the next 2 weeks. And again, I just want to extend my thanks to the Sheriff's Department and to the courts and all of our justice partners for helping to ensure a coordinated process for identifying those individuals who are most at risk and allowing us to connect them with services wherever possible. As a brief summary of the bed snapshot for today across the county, we have 1,548 open medical, surgical, general acute care beds. This includes 247 ICU beds. About a third of those beds are located within DHS's system of county-operated hospitals. You can always find all of the most up-to-date bed numbers on our website at dhs.lacounty.gov. As I've mentioned before, All of the hospitals are working on implementing their surge plans in line with the governor's order and expectation of having hospitals be the primary site of surge as needed for patients with COVID-19. This is then supplemented by alternative care sites such as the LA Surge Hospital and the Mercy Ship, as well as other sites. Finally, just want to close with a note of gratitude again for all that people are doing to support the Safer at Home efforts and to support social distancing guidelines. You've made a huge difference in curbing this epidemic, and we're very thankful for your efforts. With that, I'll turn it over to Kevin McGowan, the Director of the Office of Emergency Management.
Thank you, Dr. Galley. Kevin McGowan, the Director with the Office of Emergency Management. Good afternoon. I want to take a moment to recognize and state how proud I am of our county family and our response to this emergency, and especially the dedicated professionals that come from many different agencies and disciplines, not just from the county, but from our partners at the state and federal level that are supporting operations at our Emergency Operations Center, which has been activated for over a month period of time. The Emergency Operations Centers for the county provide some critical functions in our ability to combat the emergency that we're undertaking right now. And one of those critical factors I'd like to take today a few moments to discuss, and it's the medical shelter program. So since its inception, we've been focusing on building capacity to help our different partner agencies in preparing for the surge, and in addition to that, providing adequate level of support for people who may not need hospitalization, but might not be able to provide that support for themselves. And so the development of the medical shelter program took place and is being coordinated and led through the Emergency Operations Center with a multidisciplinary group of individuals. Currently, the county is operating 6 medical shelter sites, and approximately 900 units are encompass those 6 sites. Currently, we have about 130 people that are residing at those sites so that they can use the quarantine and isolation period of time with those wraparound supportive services, and that once they accomplish the goal of that time period, we then discharge them back to a better place than when they originally came. I can't underestimate or underemphasize how important the partnership has been with our community. I've spoken a few times at these press conferences and asked for the support of a whole community approach to this mission. It really takes all of us to come together. This is a big burden and lift by all of us, and I'm really appreciative of the support that we've had from all of our communities where these hotels, motels, and RVs are functioning. And it's a very critical and important role. And I know that all the guests and clients that are using these facilities are very appreciative of the support. And with that, it's my honor to introduce Heidi Marston, the Director for the Los Angeles Homeless Services Authority.
Good afternoon. I'm Heidi Marston, the Interim Executive Director for the Los Angeles Homeless Services Authority. LAHSA and its partners are working around the clock to urgently bring as many people experiencing homelessness as possible indoors. We're doing this through a few areas of focus, including unprecedented rapid expansion of our interim housing portfolio. We're providing intensive and focused outreach to our most vulnerable on the streets, and we're also securing resources, staffing, and supplies that are needed to support all of those functions and the expansion of our homeless system. As you've heard, we're focusing really on 3 tiers of interim housing. The first tier, Dr. Galley and Kevin spoke about, which are the medical shelters. The second tier are our countywide congregate interim housing shelters. This includes the 7,300 interim housing beds that already existed within our system across the county, and they're shelter beds for individuals that operate 24 hours. Also encompassed in this is 900 beds that are at our winter shelter program sites Generally, this program ends March 31st, but our providers have extended their programs through the end of September and are open 24 hours, bringing an additional 900 interim housing beds online for individuals experiencing homelessness. This also includes the LAHSA-managed and city-operated recreation center sites across Los Angeles City that has 565 beds across 13 shelters. So we're rapidly expanding that portfolio. The third category is, as you heard earlier, is what we refer to as Project Room Key. Project Room Key is a partnership between LA County, LAHSA, and the state of California to secure hotels and motels for the purpose of bringing people who are experiencing homelessness inside. These are for individuals who are deemed highly vulnerable per CDC guidance, meaning over the age of 65, or individuals who have underlying health conditions, and individuals who are asymptomatic, so not yet sick or exhibiting symptoms. The goal is to bring 15,000 rooms online countywide, and LAHSA, the City of LA, and the County of LA will be leveraging money we've received from the state for Project Room Key, and will also be looking to FEMA for federal reimbursement for these efforts. As I said, we're really prioritizing individuals for these sites who are unsheltered, currently living on the streets, or who are in shelters and deemed highly vulnerable, where they'll be better suited in a setting where they're on their own because of their vulnerability. This is also an effort to help us decompress our shelter sites to ensure we're maintaining at least a 6-foot distancing between the beds within our shelters. As of this morning, I'm excited to announce that in partnership with LA County Fire, we've opened 5 sites since last Friday that now provide over 405 rooms for these people experiencing homelessness who are at the highest risk during this pandemic. By early next week, we'll have more than 800 beds online across more than 12 sites countywide. Again, I just want to emphasize the amount of work that's been done to not only get these beds up and running, but thank our service provider community who has stepped in to make sure that these beds are operational and that folks in these beds have the supportive services they need during this time. Each site is operated by a homeless service nonprofit provider with professional expertise in administering services for people who are experiencing homelessness. Each site is also supported with nurses who conduct medical screenings twice a day for both the people who are staying at the hotel as well as the staff to ensure that we're monitoring symptoms, and if folks become symptomatic, we're able to move them to a place where they can self-isolate. Additionally, we're contracting with private security firms to provide 24-hour security at each of these locations, and each hotel resident receives 3 meals a day in their room. All the occupants are expected to abide by the Safer at Home order, just like all of us, and social distancing guidance is in full effect. So we're very excited about this opportunity to bring folks inside and to make sure that we're preventing the spread of coronavirus among this very vulnerable population. I also want to take a minute to talk about what we're doing to address emerging information nationally on the disproportionate impact of COVID-19 on African Americans. In recent years, LAHSA has become a national leader on advancing racial equity in homeless service systems, and we've been changing how our system works to reverse the decades of institutional racism that has led to disproportionate levels of homelessness among African Americans. We're tapping into that expertise and engaging with national experts to measure and minimize disproportionate impact of COVID-19 on Black people and people of color. And we'll also use that data to keep improving our system to advance equity throughout it. And with that, Grace, we are now ready for questions.
Thank you. Ladies and gentlemen, if you wish to ask a question, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question, you may press 1 and then 0 at this time. And our first question is from Jim Rope with Westwood One News. Please go ahead.
Thank you very much. Good afternoon. And on World Health Day, thank you very much, doctor and doctors, for your service and your help with all of this. I'm curious about the long-term care facilities. There seems to be an enormous outbreak in these places. Aren't they under the same sanitary guidelines as hospitals? And if not, why not? And when the outbreaks began in these facilities, was there guidance sent to them to clean, disinfect, do whatever, contact trace, and all of that? They seem to be petri dishes for this thing. So what is the underlying cause? Is there an underlying cause? Does this speak to these facilities in general? Why do these long-term facilities seem to have such a problem?
It's a great question. So I think I want to start with noting that while the list is very, very long of the number of institutions where we're doing investigations, in the majority of the institutions, we don't yet have outbreaks, which really means we have less than 3 known cases or presumed cases of COVID-19 among residents in the institutions, which really brings me to the second part of the question, which is what do we do and how are we supporting institutions to have the best infection control practices? As soon as we know that there is a case in any institutional setting, we have a team that actually makes contact, oftentimes goes out and reviews what the practices are and the protocols that are in place in these institutional settings to prevent spread. So I want to say that there are very strict regulations in all licensed healthcare facilities, including long-term care and skilled nursing facilities, for in fact being able to absolutely do good infection control. And they're all required to have protocols in place that allow them to both isolate people who are positive for COVID-19, presumed to be positive for COVID-19, or close contacts of anybody who may have either a positive diagnosis for COVID-19 or potentially is positive for COVID-19. But the reason it's so easily transmitted, COVID-19 so easily transmitted in these institutional settings, is because people are often both physically close together for activities, for meals, and their caregivers in these institutions who are doing incredible jobs taking care of some very ill people who need a lot of support, often care for more than one person during the day. So if in fact an employee in a facility is positive for COVID-19 and is asymptomatic, not showing any symptoms, and is caring for 10 to 15 patients in a facility, you can see that the risk for there being exposures is much higher. And at this point, we have increased our capacity to supply these facilities with surgical masks, and we've asked that, in fact, all care be done with surgical masks. But routine care in these facilities does not require the same level of personal protection equipment that is, for example, required at hospitals. And we have lots and lots of different employees working with many patients. So we also have patients who infect each other because they often share rooms and they share time together. So in all of these facilities, everyone's doing everything they can to reduce the spread, but the facilities are organized in a way that actually makes that spread somewhat easier. And I'll take the next question.
Thank you. Next, we'll go to the line of Brian Melly with AP. Please go ahead.
Yeah, hi, Dr. Ferrer. I'm trying to better understand this number of negative lab results that you previously referred to. I think you said it was around 20,000 yesterday. Can you tell me what does that number reflect? Is it from the universe of the 36,000 tests conducted that you reported today? My assumption would be that if you tested 100 cases and 10 were positive, then 90 would be negative. Is that not what that figure reflects? And is that not being reported? And what impact does the lack of that data have on your modeling?
Yeah, I mean, obviously we're troubled by the lack of electronic reporting of lab results for some of the newer labs. I want to note that everyone's working really hard to get those systems up and running. But if you think that there may be 20,000 lab results that are negative that haven't been included in our calculations, you're absolutely right to note that the calculations are off. We hope that this problem will be resolved by next week and that we'll be getting both accurate reporting on negative cases moving forward and also address sort of the lack of reporting over the past couple of weeks. But if you think about all of the new testing that's happening across the city and the county, you'll know that the 36,000 number of test results in people that I've been reporting is definitely an undercount. And we think it could be as high as 20,000. So we're hoping to fix that. You're right that it depends. The number of people you test tells you the positivity rate, and without an accurate number, we're all going to be disadvantaged. I do want to say the lab companies are cooperating for the new labs that are coming on board. Getting into the electronic lab reporting system is not an easy, it's not such an easy feat, but everyone's working hard. So hopefully by next week we've got this straightened out. But thanks for the question. Next question.
Thank you. And next we'll go to the line of Elizabeth Chow with LA Daily News. Please go ahead.
Hi. Actually, this question is probably more for Heidi Marston. I was wondering about the 15,000 number. At what point did LASA and others decide that that was not only a number that was necessary, but also feasible to do? What changed or what happened that led to arriving at that 15,000 room number for Project MC? Thanks.
Great. Thank you for the question. The 15,000 number came from a best estimate that we have from a few sources. First, at LASA, we looked at our homeless management information system that told us that we have thousands of people who we've interacted with within the last 6 months who are over 65 and or have an underlying medical condition that would deem them vulnerable. In addition, we built off of the report that was published by Dr. Dennis Colhane and Randall Kuhn that looked at data coming out of Los Angeles and New York to estimate the impact of COVID-19 on the homeless population, and through that extrapolated the 15,000 as an estimated impact. So based on what we recognize the minimum need to be, we use that to build our goal and are building to that, recognizing that we know that at least 15,000 will be the need for individual rooms, and we'll continue to build as needed.
Question.
Thank you. We'll go to the line of David Goldstein with KCVS TV. Please go ahead.
Hi, I have a question for Supervisor Solis. The last couple of days I've done a series of stories on MTA and MTA bus drivers who feel that the system is unsafe because of the virus. Not enough is being done to ensure their safety and the safety of passengers. They talk about they're only given one mask, one glove, and a small container of sanitizer. And their message was they think it should be temporarily shut down. Is there anything to that? Is that being considered to shut down mass transit, at least temporarily? And also, when will they get more supplies to keep them safe?
Well, first of all, I would say that MTA, Metro, and their staff have been working very diligently. This is a high priority for many of us, especially the board members, Board of Supervisors who sit on the Metro board, because we know that for many people, their livelihood depends on the bus service and the rail service. So I don't think we're in a position right now to stop bus service because it still remains very, very critical for many people who have to make doctor visits or pick up their medicines or just get around to maybe pick up items that they need. There are many people that rely on that service. We know that overall, though, that the number of people that have used the Metro system has gone down dramatically, and that's no surprise, but we remain very diligent. I know the staff is very diligent about cleanliness, and every time they have an opportunity, they provide that. I can only tell you that I know that our CEO there, Phil Washington, has been keeping us abreast in terms of making sure that the staff is adequately trained, that they have appropriate sanitation, gloves, and masks, and they have put up, I think in some of our buses you might have noticed where there is a screen that keeps them away from individuals that come on the bus, and now people are boarding from the rear entrance unless you have a disability and you need to use, say, a wheelchair or something of that type to board the bus. But I would say overall that Metro is doing probably one of the better jobs, and when you compare Metro to other parts of the country. Thank you. Next question.
Next, we'll go to the line of Christopher Weber with the Associated Press. Please go ahead.
Hi, thanks. A question for Heidi Marston. You said as of this morning there were 5 sites, 405 rooms. Do we know how many of those rooms are occupied today?
Hi, this is Heidi. Thank you. Of the rooms, so we're opening some every single day. As I said, the first site opened on Friday. So as of this morning, about 300 rooms were occupied, recognizing that some of those sites just came online yesterday. So by today, most of those will be filled, in addition to the sites that we're bringing online today.
Next question, please.
Thank you. Next, we'll go to the line of Olga Garoyans with LA Daily News. Please go ahead.
I have a question about ventilators. Governor Newsom shipped hundreds of ventilators to the national stockpile last week, and I was wondering what's the situation in LA County, how many ventilators are available, and if you are expecting a shortage of ventilators.
Okay, that's a question for Dr. Christina Galley.
Hi, thanks for the question. We have about 1,000 ventilators that are currently unused and available for use. These are located across all of the hospitals, both public and private, across LA County. On top of that, the EMS agency has about 300 additional ventilators that are available for distribution to hospitals. If a hospital starts to run low on a ventilator, that's not a situation we're currently in. Half of those ventilators have already been serviced thanks to the state of California's efforts, and half are currently being reserviced and will be available for use shortly. So at this point in time, we do not foresee any shortage of ventilators, and we have adequate capacity to be able to take care of patients who have a need for mechanical ventilation.
Next question, please.
Thank you. Next, we'll go to the line of Melanie Mason with LA Times. Please.
Hi, Dr. Ferrer. I have a question with regards to the racial data that you put out yesterday. My understanding is that's preliminary data, but we did notice with regards to the deaths among the Latino population that actually appears to be lower than their share of the population in LA County as a whole. We're wondering if your department has any theories as to why that is, or if there's any interventions specifically aimed at that community that may have helped.
Yeah, you know, these are great questions, but I probably want to start with the caveat that that data was incomplete, and we have 45% of the death records did not have information on race and ethnicity, so we're going back to try to get that information to make sure that what we reported actually still holds when we have the complete sample of people who have passed away. So yes, right now it was about, I think, 28% of the deaths occurred amongst Latinx, but we know that here in LA County, Latinx people make up about 50% of our population. But because it's so preliminary, it's probably not a good idea for us to either hold that number as the number that's an accurate number, or to really look and try to figure out what may be happening differently in a community, in the Latinx community, when compared to some of the other communities. I will say that, as I noted in the conversation yesterday, this becomes a very difficult conversation because it's rooted in a long history of African Americans having much worse outcomes than everybody else. And in fact, as I noted yesterday, black babies die at 3 to 4 times the rate of white babies in LA County and in most of America. And the same holds true at the end of life. Black residents here in LA County are much more likely to die 10 years before just about everybody else. And it's not about their personal health behaviors. It's not about their access necessarily to care. It has more to do with experiences around racism and discrimination and what that does in preventing you from having access to opportunities and resources, as well as the stress on your body for experiencing every day that level of discrimination and racism. So we have to look hard at sort of our history and what's happening today and make sure that we understand what are all the different factors that contribute to higher mortality rates among some people in our community and lower mortality rates among others, and then use that information not to just talk, but to actually then take actions that really do what I call level the playing field, so everybody has what they need to be as healthy as possible. And this is another opportunity for us to look at the information we have that allows us within this pandemic to make sure that our responses are appropriate in getting everybody the resources and opportunities they're going to need to stay healthy, and if they are sick, to make sure that they have access to the very best care possible. But thanks for your question.
Next question.
Thank you. Next, we'll go to the line of Patrick Healy with NBC4. Please go ahead.
Hi, thank you very much. Question regarding the institutions and dealing with the incidence of COVID there. A situation out of county today in Riverside, an institution had to be completely shut down and an emergency evacuation was conducted. What plans does LA County have for that eventuality if nursing homes and other assisted carers actually need to close down?
That's for Dr. Ferrer.
And Dr. Galley. No, Dr. Galley and I work together on making sure that the capacity of our healthcare system is preserved. And we work very closely with all of the different healthcare sectors and healthcare providers to make sure that we have plans in place. You know, I want to say, starting off, I hope we never get there. I hope we never have such a huge outbreak in one facility that the only solution is for us to absolutely have to move everybody out. I do want to note that we have quarantined already entire facilities to try to, you know, really make sure that we don't get to a place where there are so many people that are infected in one given institution that it's impossible to actually do the kind of isolation and quarantine that's needed to avoid a continuation of serious illness and even, unfortunately, deaths, because these are very vulnerable people who live in many of these institutions. But we do have plans in place to make sure that there are always places for people to go who need to be isolated and quarantined. And that doesn't mean they go to take up our hospital beds. So I want to be clear that we would never try to move people back into hospitals who don't need hospital care during a pandemic, because those beds need to be available for those who need hospital care. But we do have plans, and when we set up these medical facilities, they're there for a purpose. They're there to try to make sure that we can handle at different levels of acuity folks who cannot stay, have no place to go, but need to be quarantined and isolated, and we need to make sure we can do that in safe ways. But I'm hoping that we don't have to do that here.
Hi. I want to echo what Dr. Farrar said about making sure that as we deal with the whatever the issues are in various institutions, that we manage the problem in a way that preserves the acute care capacity in our hospitals for the patients that need acute care. I think we need to make sure that we're safeguarding that capacity and handling it in an appropriate way. And to that end, there's a variety of ways that this can be handled through quarantine and isolation sites. For certain patients also, perhaps the medical shelter is an option depending on their specific needs. Recuperative care sites in the interim housing capacity that Heidi Marston spoke about earlier might be appropriate for some portions of patients. There's also options to build out some of these alternative care sites that are under development to be able to handle COVID positive patients or patients at risk or thought to potentially be COVID positive in a way that helps turn them into potentially COVID positive facilities able to add additional capacity if there's a situation in which these institutions might need to close. We'll take the next question.
Thank you. Next, we'll go to the line of William Lagunes with Fox News. Please go ahead.
Yes, a question first for Supervisor Solis. Have you received any financial projections as to shortfalls in tax revenue or hotel tax revenue? And do you foresee any furloughs as a result of that? And for Dr. Ferrer, a little unusual, but looking back, were there any increases in seasonal flu prior to the recognition of COVID-19? Some have suggested that because we are the number one source of Chinese tourists, that we may have had a spike in what was then considered seasonal flu before it was recognized as coronavirus? Thank you.
So just quickly for the County of Los Angeles, obviously we are in a stay-at-home mode. So we are actually having our businesses kind of stop. And because of that, we know that we're not going to be receiving any sales tax, property tax, and other types of funding. We understand that very clearly. We're going to have to be working through, again, in the process, the next couple of weeks to find out exactly where we're at, but I know that the federal government is providing, I would say, ample support at this time. We know we're going to need more. I'm very happy that the governor, Gavin Newsom, has been very, very forthright about also assisting the county and providing essential dollars so that we could treat the COVID-19 pandemic in the way that it deserves to be treated here in Los Angeles County. But we will wait and see what our projections are. I know our CEO, Sachi Hamai, is working very, very diligently at this time to help us come up with the best product. We don't, at this time, I would say we don't foresee any furloughs right now. We have a workforce. Many are working at home with their laptops and conducting business. We still have essential services provided, and that's the job of the county. So at this point, we're moving forward, and I'm very pleased to see that our county employees and stakeholders are very resilient, and I want to thank them for that. But now I'll turn it back over to Dr. Ferrer for the second part of the question. The increase in the seasonal flu.
Yeah, so we actually, we track seasonal flu, pretty much every day. It looks to us like seasonal flu, where we don't have another peak of seasonal flu. We had more what we call influenza-like illness showing up at our emergency rooms, but upon test results, we actually don't see an increase in the number of cases of flu. Some of that, I think, could be attributed to some slight increase in COVID-19 patients that are showing up in emergency rooms. And the other part of it is there's other respiratory illnesses. But we do think that we are headed towards, as usual, much less flu in our communities. Generally, April and May, we start seeing a significant decrease in influenza activity. But I can keep you posted on that, so thanks for reminding us, because we do track that information. We have time for one more question.
Thank you. Next, we'll go to the line of Steve Gregory with KFI News. Please go ahead.
Good afternoon, everyone. Dr. Ferrer, for you real quickly, I haven't been on a couple of days, so I apologize in advance for rapid-fire questions. Of those who have passed away, were all of those individuals on ventilators? Also, what's the status on the death of the teen from Lancaster? And in your patient count, when you talk about positive cases and institutions, are you including VA facilities or veterans facilities? And for Dr. Galley, do you have a magical number on all of the stuff that you actually need? Do you know exactly how many PPE you need, how many beds you need, how many ventilators you need? Do you have a magical number for your goal? And also for Supervisor Solis, given some controversy in the last meeting that you tried to hold on the phone, will the public be able to exercise their legal right and participate in the next board meeting? Thank you.
Thanks a lot. I'm going to go through fairly quickly on my section. I don't have the exact number of people who have died who were on ventilators before they passed away. I will say that the majority of people who did pass away were in fact were hospitalized at the time, and the majority were in intensive care units. But I will look for that information and try to get back to you with that. We're still waiting for lab results from CDC for the young person who passed away in Lancaster, and once we have a confirmed diagnosis for death, I'll also pass that along. And I have to check on the VA facilities. I will tell you that I know all of the positive cases. They're all required to report to me, but I don't have information specifically on the VA facilities, and I would have to get back to you with that information as well. And I'll turn it over to Supervisor Solis.
So your question regarding our next meeting that is scheduled, I just want to clarify that the initial meeting that we held, first time under the emergency rules, that the governor put forward. We actually received well over 2,000 inquiries and questions. And I know that we did our very best to try to address a lot of those issues. Our staffs also provide that assistance as well as our departments. Looking forward to the next meeting, we expect to hear from a lot of people. In fact, we've seen an increase in people that have actually emailed our offices individually asking about many of the procedures and policies that we've been carrying out, whether it's been on rent stabilization, prohibiting evictions, making sure that small business loans are provided, that people know where to get appropriate foods, substances that they may need in a time of need. Many things have been happening. So we're very, I think, aware that the public is dealing with this in a way that we think is appropriate. But we remain to keep our offices open, and just because you don't see all of us here today doesn't mean that we're not listening and taking into consideration all of the voices from the public. So I will just leave it at that. But we continue to work through this just as many other local municipalities are as well. And I thank the public for their participation and for their patience. Dr. Galley.
Hi, thanks for your question. It really speaks to information that we plan on sharing on Friday related to the output of the modeling that we've been doing for anticipated demand of beds in the LA County region. So that would include total needs for hospitalization, the expected demand for ICU beds, and the expected demands for ventilators. I'll just point out at this point in time, there's no single magical number. Models are models. They can project around a range of scenarios. They can project around a most likely or a most possible scenario, but there's still understandably a range of uncertainty around all of those numbers. So while we'll put our best guess forward, and we're happy to share that and discuss that in greater depth on Friday, it has to be taken with the caveat that they are just models, and we all are moving forward with a certain degree of uncertainty. And part of that uncertainty has to do with the vigilance with which people maintain social and physical distancing. With that, we'll conclude this portion of the conference and move to Spanish remarks. Thanks, everybody.
Buenas tardes. Gracias por escucharnos hoy día. Soy la supervisora Hilda Solís de la Junta de Supervisores del Condado de Los Ángeles. La doctora Barbara Ferrer y nuestros expertos están aquí para dar información sobre la salud de nuestras comunidades y noticias de coronavirus. También están con nosotros representantes de LASA, la Autoridad de Servicios para Personas Sin Hogar de Los Ángeles, y van a decir lo que estamos haciendo para proteger a las personas sin hogar. Todos nuestros departamentos del condado y grupos comunitarios estaban trabajando todos los días para ayudar a todos quienes necesitan ayuda. Quiero dar las gracias a nuestros empleados esenciales por sus servicios. Empezando hoy, el Colegio Comunitario del Este de Los Ángeles está ofreciendo pruebas de coronavirus gratis. Si estás tosiendo, tienes fiebre o no puedes respirar, por favor llama a 211 para hacer la prueba de coronavirus. No debes de tener miedo. Nadie te va a preguntar por tu estatus migratorio. Tienes que llamar a 211 para hacer una cita primero y tener ciertos síntomas. Me gustaría tomar un momento para dar gracias también al gobernador Gavin Newsom. El viernes el gobernador Newsom anunció un proyecto llamado Project Room Key para ofrecer a las personas sin hogar un cuarto en hoteles o moteles a través del estado. Las personas sin hogar corren más riesgo con coronavirus porque muchos son de la tercera edad y tienen problemas de salud. Project Room Key va a ofrecer hogar, comida, servicios de salud mental y atención médica durante esta crisis de salud pública. El condado está trabajando con el Estado para proteger a las personas sin hogar y a todas nuestras comunidades para reducir los casos de coronavirus. Muchas gracias. Con eso me da un honor a introducir la doctora Barbara Ferrer, directora de Salud Pública.
Buenas tardes a todos y muchas gracias, Supervisora Solís. Es un honor trabajar con usted y ser parte de este equipo colaborativo. Para actualizarlo sobre nuestro estado actual, estamos tristes de informarles que hay 29 personas adicionales que han muerto desde ayer. Esto eleva el número total de muertes a 198 en el condado de Los Ángeles. Y nuestra tasa de mortalidad de COVID-19 es 2.6%. Para aquellos de ustedes que han perdido a un familiar o amigo por COVID-19, lo sentimos profundamente. Pensamos en ti todos los días mientras hacemos este trabajo. Está en nuestros pensamientos y oraciones. Hoy también estamos reportando 620 nuevos casos. En las últimas 48 horas ha habido 1,170 casos nuevos. Hay un total de 7,530 casos en el condado de Los Ángeles. 1,714 personas han sido en algún momento hospitalizados, el 23% de todos los casos positivos. Puede ver el informe actualizado de los casos del condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. Actualmente estamos investigando 131 entornos institucionales con al menos un caso confirmado de COVID-19. Estos incluyen hogares de ancianos, instalaciones de viviendas asistidas, refugios, centros de tratamiento, viviendas de apoyo, instalaciones correccionales. El total de casos confirmados en entornos institucionales es 596, incluyendo 314 casos confirmados de residentes y 282 casos con empleados. Nos entristece informarle que 37 residentes han muerto por COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y en vida asistida. Los trabajadores de salud son la primera línea de esta pandemia y todos os debemos una enorme gratitud por su trabajo. Y muchas gracias a todos ustedes. Hoy quiero informar sobre casos entre nuestros trabajadores de atención médica en el condado de Los Ángeles. Hemos documentado 324 trabajadores de salud que dieron positivo para COVID-19. Los 3 entornos principales que informan estos casos son hospitales, informando el 58% de estos casos, instalaciones ambulatorios que informan el 16% de los casos y servicios médicos de emergencia que informen el 6% de los casos. Las enfermeras son el grupo de trabajadores de salud con más probabilidades de dar positivo para COVID-19, siguiendo por los médicos, los paramédicos de EMS y los EMTs. Un vez más, la palabra de gracias no puede transmitir la gratitud que siento con todos los trabajadores de la salud. Ustedes son héroes y apreciamos su compromiso de seguir cuidando a todos nosotros. Hasta el 7 de abril, más de 36,500 personas han sido evaluados en el condado de Los Ángeles y el 15% fueron positivos. Este número va cambiando cada día. Le doy las gracias al doctor Kazan para aumentar los sitios donde nosotros podemos sacar las pruebas si tenemos síntomas del COVID-19. Quiero pasar unos minutos hablando de la orientación para personas con discapacidades durante la pandemia de COVID-19. Como hemos mencionado, las personas con afeccionados crónicos, como enfermedades cardíacas, pulmonares y renales y el diabetes, tienen un mayor riesgo de enfermarse gravemente si se infectan. Las personas con discapacidades a quienes tienen afecciones de la función pulmonar también pueden tener un riesgo elevado. Para todos, la mejor manera de evitar la infección es reducir el contacto con las personas que pueden portar el virus y con los lugares donde pueden estar presentes las personas infectadas. Limite todo lo que puede en contacto cercano con personas que no sean sus cuidadores. Si es posible, incluso los miembros del hogar deben mantenerse a 6 pies de distancia. Los cuidadores deben tener cuidado de no llevar el virus a tu casa. Si tienen algún síntoma de enfermedad, deben quedarse en su casa y mandar a un cuidador alternativo. Incluso si no muestran signos de enfermedad, los cuidadores deben usar guantes desechables y una máscara facial en cualquier momento cuando su trabajo requiera un contacto cercano con usted. Tienen que limpiar siempre las superficies que ambos tocan. Y es una buena idea limpiar regularmente todas las superficies y los equipos regularmente, así como también que todos se lavan las manos con frecuencia y evitan tocarse la cara. Asegurarse de tener un plan personal de emergencia que incluye información de contacto de su farmacia y cómo comunicarse con todos sus médicos. Y otros servicios también tienen que estar en este plan, como programas de comidas o coordinadores de atención o servicios de telesalud. Haga los arreglos ahora para obtener la atención que necesitas en cualquier servicio médico crítico fuera de la casa. Si necesitas salir para recibir estos servicios, asegurarse que tienes un plan de transporte que le permita llegar allí sin riesgo adicional. Si desarrolla síntomas, póngase en contacto inmediatamente con su médico. Y tenemos una guía detallada para personas con discapacidades en nuestro sitio de web, publichealth.lacounty.gov. Quiero agradecerle a muchos de ustedes por ser acostumbrados de seguir cerca de las órdenes de quedarse en la casa y mantener la distancia física y usar tapabocas de tela para su cara cuando se encuentran fuera de la casa. Esto es temporal, cambiará y volveremos a nuestro estado normal, pero no sabemos cuándo ese día viene. Por ahora tenemos que quedarnos unas semanas con todas las maneras de sacar la distancia física y quedarse en la casa. Sé que es difícil, que todos los miembros de nuestra comunidad están haciendo muchos sacrificios y muchas gracias a ustedes. Muchos de nosotros estamos pendientes que las días, fiestas y tradicionales de nuestra fe están en este momento y esta semana. Y está bien difícil que tenemos que quedarnos en la casa. Y esto no es fácil, pero estamos aquí juntos en esta fuerza. Sigue haciendo todo lo posible para reducir la propagación del COVID-19. Y ahora me da un placer traerle al señor Delgado, José Delgado de LASA.
Muchísimas gracias, doctora Ferrer. Buen día. de parte de la Autoridad de Asuntos de Gente Desamparada de Los Ángeles, les damos gracias a todo aquello que se involucra en las obras que actualizamos hoy. El plan para el bienestar de la gente indigente en Angelina se acata a asegurar las medidas de mitigación comunitaria ante la pandemia de COVID-19. O sea, tomar en serio las precauciones para evitar la propagación del virus entre esta población. La Autoridad de Asuntos de Gente Desamparada, con el gran apoyo del Condado de Los Ángeles y el Estado de California, ha tomado medidas de seguridad sanitaria para establecer una red de hoteles y moteles que servirán como hospedajes de aislamiento temporales para aquella gente asintomática que se encuentra en los grupos de mayor riesgo. Estas acciones son parte de la iniciativa Proyecto Roomkey. Hay un llamado para asegurar 15,000 cuartos individuales a través del condado. La Autoridad de Asuntos de Gente Desamparada, el condado y la ciudad de Los Ángeles, colectivamente hemos asignado un poco más de $39 millones en recursos de emergencia estatales hacia estos esfuerzos. Como parte de esta asistencia, FEMA contribuirá el 75% de lo que se utilice de acuerdo con los requisitos asignados. Hasta ahora, nuestra prioridad ha sido la identificación de aquella gente adulta mayores, o sea, mayor de 55 años, o de otros grupos de mayor riesgo indigente. La población que ocupará estos hoteles será una combinación de aquellos que presentemente se encuentran en albergues, pero no pueden tener sana distancia, o sea, 6 pies de libramiento, incluyendo miembros de la comunidad desamparada que se encuentran en la calle. A partir de esta mañana, hemos afianzado 5 moteles produciendo más de 400 cuartos para nuestra población más vulnerable. Durante las próximas semanas, esperamos tener un total de 12 sitios y más de 800 cuartos a través del condado. ¿Cómo funciona el proyecto Roomkey? Se asegurará un proveedor de servicios que se encargará principalmente de manejar cada instalación. Todo proveedor tiene experiencia en la administración de obras como estas y tendrán planes de apoyo y varios servicios para cada cliente. Más aún, cada planta de operación será apoyada con la presencia de un equipo compuesto de una enfermera o enfermero y un guardia de seguridad que vigilará las 24 horas al día. Cumpliendo con las recomendaciones del Departamento de Salud Pública, todo participante requerirá someterse a un chequeo de salud para asegurar que no esté presentando síntomas de COVID-19. Esas revisiones médicas se administran antes de llegar a las instalaciones y en varios puntos durante el día. El acceso a cada sitio será restringido solamente para aquellos clientes y personal manejando el hotel. Para hacerse seguro de que no haya problemas, cada habitante tendrá un identificador que demostrará su registro al sitio propio. Nadie más podrá acceder al hotel sin ese permiso o identificador. A todo habitante se le espera que acate con las medidas de seguridad sanitaria y observen la sana distancia, como cualquier angelino aquí en el condado. Igualmente, se le espera que todo cliente se mantenga en su hospedaje y solo estén saliendo para cuestiones básicas. Esperamos que estas medidas encuentren éxito en su propósito hasta el tiempo que cumplen. Gracias, y en este momento tomaremos preguntas. At this point, we'll take questions in Spanish.
¿Hay preguntas? Is there a question?
Thank you. We'll go to the line of Raymond Mesa with Telemundo 52. Please go ahead.
Buenas tardes, Raymond Mesa de Telemundo 52. Una pregunta para la doctora Ferrer. Las cifras que nos dio el gobernador el día de hoy en la mañana son casi iguales a las que la doctora nos proporcionó ayer y vemos que el porcentaje de latinos sigue siendo el más afectado. Quería saber si se está haciendo algo a nivel del condado para ayudar a esas comunidades latinas y afroamericanas para que se hagan la prueba o para que reciban mejor atención médica.
Sí, voy a hablar por un momento, pero también yo creo que la supervisora tiene muchas ideas sobre esto también. Me da pena que en nuestras comunidades no tenemos en este momento acceso a las pruebas que debemos tener. Y esto por seguro es una falla bien importante que tenemos que cambiar. Todos que están enfermos y que tienen un médico que dice que tienen que coger la prueba, tienen que tener acceso a las pruebas. Y al mirar al dato me da pena de reportar que hay diferentes accesos, depende de donde una persona vive. Pero estamos tratando muy duro ahora en estas semanas que vienen a hacer el cambio para todos que necesitan esta prueba se pueden sacar la prueba, porque las pruebas son gratis. Este no es un problema que una persona tiene que tener seguro, es un problema que no tenemos lugares por todos sitios donde personas pueden ir para sacar la prueba. Pero vamos a hacer ese cambio. Ojalá que cada semana tenemos más sitios en las comunidades donde viven la gente afroamericanos y los latinos y para que ellos puedan conseguir bien sencillamente esa prueba si tienen síntomas y si su médico decide que es una prueba que debes tener. Pero también le voy a dejar a la supervisora hablar sobre esto porque yo sé, ella para toda la vida ha estado aquí para nosotros en esta lucha de tener los derechos de todos, a tener los que necesitamos para la salud.
Sí, mira, quería decir que hoy día abrimos un centro de prueba en el Colegio del Este de Los Ángeles, colegio comunitario que se llama East LA College, y ahí también están haciendo las pruebas. Hoy día empezaron y van a estar ahí justo pues para 7 días, desde las 9 de la mañana a las 5 de la tarde. Pueden ir a 211 para enterarse y para obtener información para que puedan ir a hacer la prueba. También en la área del sur de Los Ángeles, cerca del hospital Martin Luther King, ahí también donde vive la comunidad africana-americana, también tienen un centro de pruebas que hoy día también se abrió. Entonces nosotros estamos haciendo lo más posible, pero sabemos que hay otros lugares que todavía tenemos que tocar. Y hoy día quiere decir que estamos haciendo mucho más, trabajando con las clínicas también, que ya están ahí en estas áreas donde hay muchos inmigrantes y gente de bajo ingreso. Totalmente estamos haciendo lo más. Espero que en la semana que viene vamos a tener muchos más centros de prueba. Gracias. Okay. Now, I would like, if there's no more questions, I'm going to now introduce Garen Ohanesian. She is our public health nursing supervisor for SPA 2, representing the West Valley District, and she's going to be speaking to us in Armenian. Thank you.
Բարի օր բոլորիդ։ Շնորհակալություն կուզեմ հայտնել Լոս Անջելեսի շրջանի վերահսկիչ խորհրդուհին Supervisor Solis-ի եւ բոլոր Լոս Անջելեսի շրջանի ղեկավարությամբ բադիվ է բոլորիդ հետ աշխատելու։ Այսօր կուզեմ դեղակացնել ցեզ հիմակվա կացությունը։ Թշպախտապար այսօր պիտի հայտնենք, թե 29 հոգի հավելյալ մահացած է COVID-19-ով։ 17 հոգին 65 տարեկան ավելի են եւ 16 հոգին ուրիշ առողջապահության հիվանդություններ ունին։ 7 հոգին ուրեմն 41 են 65 տարեկան են եւ այս 5 հոգին ուրիշ առողջապահության հիվանդություններ ունին։ Եվ մեկ անձը թշպախտապար 18 տարեկան են 40 տարեկան է, որ ուրիշ առողջապահության խնդիրներ ուներ։ Մույս 4 անցերուն տեղեկությունները թեր չունենք մարմնամասն։ Մինչև այսօր 198 մահ կա Լոս Անջելես շրջանի մեջ։ Եվ մահացության մագարտակը COVID-19-ին 2.6% է։ Գուզենք մեր խորին ցավակցությունները հայտնելու այդ բոլոր անձիկներու, որ ընդանական անդամ կամ ընկեր ունեն, որ COVID-19-ով դժբախտաբար մահացած են։ Մեր խորին ցավակցությունները գուզենք հայտնել եւ գուզենք հայտնել թե մենք ցեզ կմտածենք եւ մեր աղոթներուն մեջ եք։ Դժբախտաբար այսօր 620 նոր COVID кейսեր ունենք։ Այս վերջի 48 ժամվա, ուրեմն այս վերջի 2 օրվա մեջ 1170 նոր հիվանդներ ունենք։ Ուրեմն թիվը Los Angeles County 7530 եղած է եւ 250 հոգի կփականա Long Beach Department-ին եւ 80 հատը Pasadena-ին։ Այսօր գուզենք հայտարարել, որ 18 հատ անձեր, այդ անձեր, որ homeless են կամ դուն չունին, 77% այս անձերեն 18-65 տարեկան են եւ ուրեմն դեղեցություններ գուզենք տալ ադոնք որ հիվանդանոցն են։ Ուրեմն 1714 անձ հիվանդանոց մնացած են, 23% ուրեմն positive են COVID-19-ով։ Հիմա 1033 անց հիվանդանոցն են, 44% 65-ն ավելի են եւ 17% 45 տարեկան են պակաս են։ 158 անձեր հիմա intensive care unit-ի մեջ են, ուրեմն ավելի խիստ ղեկավարությամբ եւ 49% ուրեմն ուրիշ հիվանդություններ ունին եւ 43% 65 տարեկան են ավելի են։ Եթե ավելի դեղեցություններ գուզեք գիտնալ, հաջիկ մեր website-ը կացեք publichealth.lacounty.gov։ Երկրորդ բաժինը որ գուզենք տեղեկացնել, այդ անձեր որ ուրիշ դեղեր գաբրին ուրիշ դեղեր առանց իրենց տուներու, ուրեմն 131 գազմա դեղեր կան, որ գփաղկանա ձերանոցներեն դուներ որ ձերեր գաբրին եւ օգնություն պետք ունին, աբասդարաններ որ shelter-ներ են, բուժման տեղերի գետրոններ եւ փանդերու մեջ։ Ուրեմն 596 հոգի ունին աս բոլոր դեղերեն, ուրեմն 314 թիվերը այդ որ բնակիչներ ունեն եւ 282 թիվերը աշխատավորներ են։ Դժբախտաբար պիտի հայտարարենք, որ 37 անց պիտի արդեն մահացած են այս տեղերեն, 43 հոգի ուրեմն փանդերեն եղած է, 300 փանդարգյալներ եւ 40 հոգի որ աշխատավորներ են։ 10 հոգի California ուրեմն փանդարգյալներ են, 8 փանդարգյալներ եւ 2 աշխատավորներ եւ 2 հատնալ երդասարտներու փանդեր կան եւ 2 աշխատավորներ եղած են։ Աբաստարանները կամ shelter-ներուն մեջ ուրեմն 5 confirmed case-եր ունենք, 3 հատը ադոնք որ հոնդեղ գաբրին եւ 2 հատ աշխատավորներ։ Մենք բոլոր այս դեղեցությունները գտնենք մեր website-ին վրա եւ գնանք նայել վերջին դեղերը։ Բայց առաջին հերթին դեղեցություն կուզենք տալ բոլոր իրենց աշխատավորներուն, բնակիչներուն եւ ընտանիքներուն։ Կուզենք հիշեցնել, թե COVID-19-ը բազմացած է բոլոր մեր շրջանին։ Մենք գտեսնենք, թե հավելյալ հիվանդներ պիտի տեսնենք այս բոլոր դեղերուն մեջ։ Ուրեմն ներկայիս բոլոր ուրեմն որ աշխատենք որ այս բոլոր դեղերուն վրա գարավարում ենք եւ իրենց guidance կուտանք որ ինչ պետք է անեն։ Մենք մեր կարելությունը եւ լավակույնը գործենք անել պաշտպանելու իրենց բնակիչներուն առողջապահության պաշտպանմունքին։ Շատ բնակիչներ թշփախտաբար quarantine կամ զատված են ճշտաբար, որբեսի ուրիշներուն հետ որ COVID-19 ունին որ ավելի զատվին։ Երկրորդ թեմին գուզենք բացատրել առողջապահության ոլորտի աշխատողները, healthcare workers։ Ուրեմն առաջին գուզենք մեր խորին շնորհակալությունը հայտնել ծեր բոլորիդ, ծեր բոլոր աշխատանքներուն եւ նվիրումին։ Գուզեմ հայտնել թե Los Angeles County-ին մեջ 324 healthcare worker-ներ ունեցած ենք որ COVID-19 ունին, 58% հիվանդանոց հիմա են, 60% իրենց բժշկին կլինիկին կացած են եւ 6% ըշտաբան ծառայություններ տեսած են, so emergency room-ի պետքեր եղած են։ So առաջին թեմով ամենաշատ թիվերովը ուրեմն բուժքույրներ կամ նուրսեր են, երկրորդ բժիշկներ հետևելով ամբուլանսի ադ շտաբ օգնության անձերուն։ Թշփախտաբար հայտնենք թե երկու անձեր healthcare worker-ներ թշփախտաբար մահացած են եւ նորին խորին ցավակցություններ գուզեն խնդրել ծեր ընտանիքներուն եւ ծեր բարեկամներուն։ Նորեն շնորհակալություն գուզենք խորին հայտնել ծեր աջակցությամբ եւ ծեր օգնությունը այս դժվարին օրերուն։ Ուրեմն քննության մասին գուզենք խոսիլ։ Մինչև այսօր ապրիլ 7-ին 36500 հոգի ուրեմն Los Angeles County-ի մեջ ստուգման ունեցած են եւ 15%-ը թրական նիշ ունին, ուրեմն positive են։ Ուրեմն գործենք որ ամեն շաբաթ ավելի լավ քննություններ ունենք, որովհետեւ ավելի արագ լա, բայց թշփախտաբար ժամանակ գլագոր մինչև որ պատասխանը ստանանք։ Գործենք որ ամեն օր 10,000 քննություններ լա, թեր at թիվին չենք հասած, բայց կուզեմ տեսնել թե ինչպես որ ավելի կբարձրանա թիվը, ուրեմն ավելի թիվերով հիվանդություններ պիտի տեսնենք։ Նորեն կուզեմ ասել թե the priority կամ առաջնահերթությունը պետք է դանք այդ անձերուն որ հիվանդ ախտանիշները ունի կամ ուրիշ հիվանդություններ ունի եւ այս ճիշտ եթե ծեր բժիշկը ուզե ցեզի քննությունը տալ եթե անձեր եւ դարեցներ ունիք որ հիվանդ են եւ even եթե շատ թեթև ախտանիշներ եթե ունիք հաջիկ ծեր բժիշկին հեռացայնեցեք որբեսի ցուկ կրնակ քննությունը ստանալ Երկրորդ թեմին ուրեմն at անցիկ որ disability ունին կամ հաշման թամություն ունին so ինչպես որ առաջացինք այդ անձերը որ ուրիշ հիվանդություններ ունին ինչպես սրդի, թոքի, երգամունքի ասանք ինչ որ հիվանդություններ ունին եւ այդ անձիկը որ disability ունին որ especially թոքի հիվանդություններ ունին գրնան ավելի դոգոս ունենալ որ ավելի խիստ հիվանդություններ ունենակ Ադոր համար գուզենք թե նորեն նշել որ բոլորս պետք է փորձենք ավելի քիչ ժամանց ունենանք ուրիշներու հետ որբեսի աս վիրուսը մեգեն մուսին չփոխանցվի So եթե խնամակալներ եթե ունիք փորձեցեք ծեր մոդուլությունը ավելի քիչ լալ եւ 6 ոտքերու մնալ Պետք է ուշադիր ըլլակ եթե խնամակալ եք եթե ովևէ մեկ ախտանիշ ունի կամ դակություն կամ չերմություն ունի, հաջիկ ուշադիր եղեք եւ ծեր անձերուն որ կխնամայեք, պետք է իրենց լուր տաք եւ չերթակ հոնդեղ, որբեսի իրենց աչի վարագեք, երկրորդ ուրիշ խնամակալը հաջիկ փորձեցեք իրենց օգնության։ Even եթե ովևէ մեկ ախտանիշ եթե չունիք, խնամակալները պետք է ցերնոցներ գլավեր կորցածեք եւ մասկ որտիմակներ պետք է կորցածեք, որբեսի մեկ անցի մույսի չփոխանցվի։ Եվ շատ կարեւոր է որ ուրդեղ որ ինչ որ գտնակ պետք է փոլորիդ նույն դեղը փոլոր ամեն ինչ մակրեք, որբեսի մեկ անցի մույս անց չի փոխանցվի։ Կարևոր է որ հաջիկ բոլոր ծեր ուդելիքները, թեղերը, ծեր պետքերը ուրիշներ ծեր դան փերեն։ Դուք հաջիկ դուրս մի ելեք։ Եվ շատ կարևոր է որ personal emergency plan, ուրեմն ծեր emergency համար ով մեկ անձեր որ պետք ունիք, թիվեր որ պետք ունիք, ինչպես ծեր բժիշկներու անունները թիվերը մեկտեղ քրեցեք որպես ավելի թյուրունը լացես եւ որ մեկ թեղարանը որ գործածեք եւ ովևէ մեկ ուրիշ եթե meal program եթե մեկը ցեզի ջաշ փերե եւ այլն at բոլոր թիվերը մեկտեղ քրեցեք որ ավելի թյուրունը լացեսի Եվ եթե հետակային եթե լավ չեք սկում, շատ կարևոր է որ 911-ը թիվը հեռացայնեցեք եւ ասեք թե COVID-19 կամ կորոնավիրուսի ախտանիշներ ունիք, որովհետեւ իրենք ալ պատրաստվին եւ ուրիշներուն չի փոխանցեն։ Եթե ովևէ մեկ ախտանիշներ եթե ունենաք, հաջիկ նորեն ծեր բժիշկին հեռացայնեցեք։ Եվ disability ունեցողներուն համար մեր website-ին հաջիկ կացեք publichealth.lacounty.gov հոնդեղ ավելի դեղեցություններ գնաք ունենալ and հոնդեղ գսեվի ինչպես գնաք ջաշ եւ ուրիշ ինչպես գնա մեգա ցեզի ուրիշ ջամփորտել մեկ անցե մուստեղ եւ նույնպես ինչպես գնաք մակրել ծեր դաները So, հիմա գուզենք շնորհակալություն նորեն հայտնել բոլորիդ ցեզ որ դուննեք եւ մեր եւ գործեք որ ծեր social distancing-ը advets ոտ անտինը եւ եթե թմակներ եթե գրնակ տնել ծեր փերանը եւ որ դուրս եթե պետք է երթալու So գուզեմ նորեն հիշեցնել որ ասիգա ժամանակից չէ ասիգա օրը պիտի կա որ իդ նորմալի պիտի կա այս pandemic-ին բայց ժամանակ պիտի դեպե եւ գուզեմ հասկացնել որ բոլորիդ որ քանի մտեր շապատներ պիտի լա մինչեւ որ այս օրդերները ելեն գիտեմ որ շատ դժվար է եւ գուզեմ որ ասել որ բոլոր մեր քաղաքին եւ as դժվար բիդելա especially մեր սուրբ սադիգին եւ ինչպես միասին գուքայինք մեր ընտանիքներուն հաջիկ դունը մնացեք եւ գրնակ նորեն իրարու հետ ժամանց ունենալ բայց փորձեցեք ուրիշ թեմայով կամ հեռացայիններով կամ Skype-երով երեխաները գրնան հավգտախա խաղան իրենց դան մեջ բայց ուրիշներու դուներ հաջիկ մի երթակ Բոլորս միասին ենք այս աճակցությամբ որբեսի այս COVID-ը ավելի գամացնենք եւ ուրիշներուն չի դարածենք Նորեն գուզեմ շնորհակալություն հայտնել բոլորիդ որով ամեն անց որ դու մնա դուք գոկնեք որ ուրիշ անցի մյանքին եւ ծեր սիրելիներուն Միասին մի աշխատենք Los Angeles County-ի հետ եւ նորեն իմ խորին շնորհակալությունը գուզեմ հայտնել բոլորիդ եւ հիմա կվերջանա մեր conference So this concludes our press conference for today. Thank you.